Hello, good evening, and welcome to the Functional Solutions discussion. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and with us we have Dr. Chill.
Hi, everybody. Welcome.
And Dr. Chill is a functional medicine physician with years of clinical experience. And every Wednesday, we join forces together to share with you the most interesting root causes for chronic conditions, treatment strategies, and some really cool studies to learn how to better help your community, your patients, and really transform their health, get a better clinical outcome. And that's why I asked Dr. Chill to join us and share from his clinical experience, and I'll share from mine as well. So today we got a really interesting topic. I would say it's very much needed with the increasing rates of high cholesterol. And so today our topic is high cholesterol and high triglycerides. And this is one of the most important topics because there's so much misconception about cholesterol. Even beginning from the 70s and 80s, where butter became butter became the evil, butter became evil, and margarine became the good thing, right? So butter was bad, margarine was good, and it was all because of cholesterol, right? So that was the claim, that butter was essentially not good for us because it raises cholesterol, right? And that, of course, leads to the massive growth of the use of statins. And so today's topic is really important because we know that statistically about 86 million Americans have high cholesterol and about 56 million Americans have high triglycerides. Also, we know that patients with hyperlipidemia is associated with twice as much likelihood of developing cardiovascular diseases than those who do not have high cholesterol. And so we're going to dive today into the causes, the risk factors, and we're going to talk about what are some of the challenges that we currently have with the conventional treatment, which is the drug therapy, and some recommendations of what can we do to mitigate that, to help our patients to become more compliant for the therapy. But what I mostly want you to get out of today's discussion is to learn about the root cause, because we're seeing two major problems if we just continue in the same way of giving a patient a prescription and sending them home. We know that, one, we have not addressed the root cause of their conditions, which leads to so many patients developing complications or continue to struggle. And second, of course, they're going to develop side effects. And you don't have to take my word for it. If any practitioners who have been in practice for several years have seen many patients start with one or two medications, and 10 years later ends up on 6, 7, maybe 10 or more medications. So we know they're not heading in the right direction in terms of their health, right? So learning about the root cause of high cholesterol can change the approach from just disease management to focus more on the patient and offering comprehensive care, preventative and corrective care that will serve your patients in the long term. And of course, we're going to talk about the two major contributing factors in the functional medicine approach. We got some really cool studies to share with you. And we're also going to talk about a few nutraceuticals or supplements that can give you a quick win when you're in your practice to recommend and consider with your patients. So, Dr. Chill, this is obviously a big topic. Take us through this really interesting topic, and what are some of the, let's say, well-known causes or risk factors with hyperlipidemia?
Yeah, absolutely. So let's go down to some of the basics before we get into some of the functional medicine approaches, right? So with hyperlipidemia, there's usually two main classifications, which is important for us to understand. The first is familial. This is a cause or a risk factor of hyperlipidemia or high cholesterol. This is due to a genetic predisposition. They have family members, their mom and their dad, or somebody in their family has hyperlipidemia, and they're passing it down through their genes, and this causes elevated levels of total cholesterol, LDLs, total triglycerides, and then decreased levels of HDL due to this genetic predisposition, and it's causing an overproduction of lipoproteins by the liver. Usually people with familial problems or this genetic predisposition, they can develop high cholesterol and triglycerides even as teenagers. And this is correlated to an increased risk of early CAD or coronary artery disease, heart attacks, obesity, and then glucose intolerance. What's important with familial is because of that genetic predisposition, what I've seen clinically is that they will have to consistently manage their high cholesterol levels with this genetic predisposition. But there are functional medicine approaches that we can use to help them with that genetic predisposition and to manage their higher cholesterol levels for them. The second classification of hyperlipidemia, this is what's called acquired or secondary classification of hyperlipidemia. This is due to a result of either an underlying health condition, a medication, or even lifestyle choices. Some of the medical indications or the medical conditions include hypothyroidism, diabetes, kidney disease, liver disease, and some of the medications include birth control pills, corticosteroids, diuretics, antiretrovirals, beta blockers, and then lifestyle factors. This includes an unhealthy diet, a sedentary lifestyle, smoking and exposure to tobacco, and then being overweight and obese. So it's these acquired and secondary classifications of hyperlipidemia where functional medicine really shines for our patients. And it's because we can handle these acquired issues for them with functional medicine approaches and lifestyle modifications for our patients.
Absolutely. And I'm glad that we started with categorizing this into a primary and secondary, because like Dr. Chill, you were mentioning, the secondary causes of hyperlipidemia is something that we can offer tremendous amount of transformation in just by making a simple one or two simple strategies, offering one or two simple strategies every time you see the patient. And when you are working in the functional medicine field, it's going to be very different than getting a patient a prescription and then I'll see you in 3 to 6 months, right? This is where we want to be a little bit more involved and put the patient, instead of putting them in the back seat, we want to put them in the driver's seat. We want to empower our patients to know that there's a lot that they can do to change their situation, right? But I will mention this, something really interesting to also know about the primary causes, which are mostly genetic. Dr. Chill is one of those practitioners who would use genetic testing. And it's really important to know that the genome testing that we are teaching in the functional medicine, the advanced and clinical functional medicine program, can give you tremendous amount of data on the patient's genetic predispositions. And this field has been so developed that by Dr. Husman and Dr. Yael, who are both pioneers in the field and developed two of the largest database we have in terms of genetic and epigenetic expression. And there are some really cool tests today, medical genomic testing, that can go even deeper in terms of the genetic levels, and then from there, what type of supplements or environment or changes, lifestyle changes, you would want to facilitate with each patient based on their genetics to change the expression of those genes. So just for you to know, in general terms, we're not gonna dive into it. We have specialists and experts that teach that in the advanced program, with case studies and how they change their patients' cardiovascular diseases and how they treat it. But just to put it out there, that even when a patient comes in and there's a clear genetic predisposition, there's a lot that we can do in terms of the secondary, and there's a lot that we can do in terms of testing for the primary aspects of hyperlipidemia, and give them even more personalized recommendations based on their genomic SNPs and variations. So just to know that it is available. It takes a little bit more learning and investment of time and effort to really dive into it, and we do that in the advanced functional medicine training. So let's go into conventional treatments. As we all know, according to the American Heart Association guidelines, statin medication are the first line of pharmacotherapy that is recommended for dyslipidemia. However, there are two major problems that we're seeing, or challenges that we're seeing with those medications. One is the side effects. This is probably one of the reasons that when you offer functional medicine, private consultations, patients would come to see you. We used to see a lot of patients coming to see us and saying, Tal, I've been taking prescribed metformin for diabetes, but it's causing me terrible GI side effects, right? Statistically, 1 out of 3. When we look at statins, we know that the common side effects are headaches, dizziness, nausea, feeling tired or weak, digestive issues, nausea, muscle pain, and sleep problems, right? Now, we might not think that these are very common, but there was an interesting published article by the American Heart Association that reported that about 4 out of 10 statin users that they surveyed struggle with at least one side effect. Most commonly was muscle aches or cramps, and then followed by fatigue, and then memory loss, right? And there are multiple other side effects, and you can read more about it in this particular published study article in the American Heart Association website. So this is where, for some patients, we can consider to offer them a more natural solution and look into the root cause, right? So use natural solution on one side to reduce the high cholesterol. We're going to talk about a few of those mechanisms and supplements. On the other hand, we want to address the root causes, right? So we don't just put a Band-Aid over it. We actually dive deeper and learn about what's contributing to that condition. The second problem that we look into when we just give a prescription is that, as I mentioned, giving medication to the patient does not resolve, in so many cases, at least chronic cases, the underlying problem that leads to higher cholesterol, right? So the patient's labs might look better a few months later, but so many patients continue to lose their health, right? So that's something that is important. So we're going to talk about another important consideration with statins. And this is something that a lot of practitioners still don't talk to their patients when they give a prescription. And we thought that it would be valuable to at least mention and talk a little bit about, because some of your patients might be on statins and they don't know why they're developing those side effects. And this particular mechanism can explain why they might develop these side effects. So Dr. Chill, take us into one of the major considerations when a patient is on statin.
Yeah, absolutely. And as you were saying, a lot of practitioners, actually some practitioners know about this, but they might not be doing anything to mitigate some of these issues with the statins, right? So with statins, what it's been shown is that there's multiple studies that have been conducted on statin use. And what has been showing is that it's been shown to decrease coenzyme Q10 levels or CoQ10 levels. And this is related to the decrease in the levels of the lipoprotein transport carriers. And this is which induces the therapeutic effects of the statin. And that's what's causing the decreased levels of CoQ10. What the studies were revealing is that exposure to atorvastatin, 80 milligrams, which is a typical dose for about 14 to 30 days, it caused a significant reduction of CoQ10 levels of 34 subjects, both at day 14 and at day 30. And you could read a little bit more about this if you want to, called, the publication is called CoQ10 and Statin-Induced Mitochondrial Dysfunction. And this was by the Oshner Journal. And this was done in 2010. Why is this important, right? So why is this depletion in CoQ10 causing some of the symptoms such as the muscle pain or the muscle spasms that Dr. Cohen was talking about? And a better way to explain this is through a picture. So let's pop up this picture here so I can explain what's happening with statins and CoQ10. So in this image here, we can see in the middle the mitochondrial inner membrane. This is where CoQ10 is. You can see the 1, 2, 3, 4, and 5. You could see that the CoQ10 is within there and it's needed within that membrane. So it plays a really important role in mitochondria function. And mitochondria is in all of our cells. You can see the mitochondrial complexes 1 through 4, and they have specialized protein complexes here. They transfer all of the electrons in the mitochondrial utilization of oxygen. What's important about this is it's a crucial cofactor, CoQ10, because it lies in the intersection of the electron transfers from both the citric acid cycle and the reaction of NADH and reduced NAD+. And that's all responsible for energy production and cellular function. So that is an important factor as to why there might be a depletion of, or why that depletion of CoQ10 can impact our patient's health and causing some of those side effects that Dr. Cohen was mentioning.
Yes, absolutely. And some of those more noticeable, of course, will be the fatigue, but also the muscle function, right? Because the CoQ10 is needed. It's an essential part, essential coenzyme in the production of energy. So think about any organ that needs energy: the heart, the muscles, right? The brain, right? And this is why, when you think about it, there's fatigue, there's muscle weakness, right? Those are all the organs that are impacted by lower amounts of CoQ10. And of course, one of the major side effects that was reported was memory loss. When you think about it, the brain requires production of energy, right? And that's something that the mitochondria is in charge of, and as the energy factor of the cell. And if we reduce the amount of CoQ10, then naturally the brain might not function as well, or the muscles and the heart and everything else, right? So that's something to think about, because we're going to go back to towards the end of this discussion about supplementation and the dosages and some of that other consideration. So this is where we are kind of taking a cut and transitioning into the more functional medicine approach. And we'll take a little deep breath for any of us who saw this picture that Dr. Chill shared with us and got a biochemistry anxiety.
Taking a deep breath now.
So we can take a deep breath in. Every time that I see those pictures, they're so interesting. But every time that I see those pictures, I'm like, oh, it takes me back to those years of biochemistry, and I'm like, okay, that's I would prefer to leave it there where
I
back.
try
So
to keep it as succinct and simple as possible.
exactly, and he did an amazing job. So that was great. And this is not to take from anybody who's we got a few community members who did degrees in biochemistry. So no offense. It's not that we don't like biochemistry. It's just it's stressful. So so this is where we're gonna dive into the factors the functional medicine factors, and of course we're gonna generalize it, because when we go through these modules in the advanced and clinical functional medicine, we have our presenters and experts have amazing way to simplify all these biochemicals pathways and use a lot of visuals to pass the message and the understanding and insights of what's really happening there. So we're going to start with factor number 1, and this is gut bacterial dysbiosis. So we have talked about gut bacterial dysbiosis, or loss of gut integrity, in relation to so many conditions. But this is where we're going to talk about gut bacteria from a whole different pathways. And so there are a few things that we're going to talk about. But as we always mention, a picture is worth 1,000 words. So we're going to share this picture from a really cool study. This is called Gut Dysbiosis and Immune System and Arteriosclerotic Cardiovascular Disease. This was published in 2022, and it's got some really cool indications and chart flows. So in this picture, you can see the disruption in gut homeostasis and how it's associated with the buildup, essentially the buildup of cholesterol, which is a part of the arteriosclerotic process. And so we're going to start breaking this down into a few sections. Essentially, this whole process involves the activation of the immune process and systemic inflammation. Or with some patient, it could be subclinical systemic inflammation, which means that it's not enough to trigger symptoms of joint pain or inflammatory bowel disorder or anything like that, right? It's subclinical, but it's still systemic, right? Now, the gut microbiota produces multiple metabolites, metabolic products. So on the left side, you can see the short chain fatty acid. It's stated here as SCFA, short chain fatty acid. It's got a little circle there that is pink on the top left, and that has a certain role that we're going to talk about, right? So when we have this production of short chain fatty acid, of course, such as butyrate, which is what they highlighted here on the bottom right side as part of the short chain fatty acid, we know that butyrate leads to a decrease in inflammation and decrease in the risk of developing arteriogenesis, right? And so that's one mechanism, right? We got the healthy bacteria that are helping us to produce short chain fatty acid, mostly butyrate, in relation to this particular dyslipidemia and arteriosclerosis, and it reduced the inflammation. And when you reduce the inflammation, of course, we have to remember that inflammation it plays a major role in the development of arteriosclerosis. So once we remove the inflammation, you have less of a reduction. You have reduced the production of those arterial plaques, right? However, on the right side, we can see if we have bacteria, if you have dysbiosis because of dietary choices, lifestyle choices, maybe the patient was taking antibiotic at a certain time in their lives, and they created a shift in between an imbalance between the healthy or beneficial and harmful bacteria, or imbalanced bacteria. This is what we call dysbiosis. So there's a disruption in the gut homeostasis, and there are certain bacteria species that are not beneficial that leads to the production of the bacterial metabolite TMA, and TMA essentially is referred to as it's trimethylamine TMA, which is used for the production of pro-arterogenic metabolites that is called trimethylamine N oxide, and that's referred to here as TMAO. So essentially, TMA goes into the liver, where in the liver, there is a higher production of TMAO. Essentially, TMAO, the problem with TMAO is that it inhibits cholesterol metabolism, the healthy physiological cholesterol metabolites, and it reverses the cholesterol transport, which removes excess cholesterol from the arterial walls. So essentially, if you have a patient that has a dysbiosis and higher production of TMAO levels, you inhibit, essentially they have an inhibition of the healthy cholesterol metabolism, which could lead to increase of blood cholesterol levels, which can promote with inflammation, foam cell formation, and arteriosclerosis. Remember, inflammation plays a significant role in the buildup of arteriosclerosis, which involves the migration of macrophages and other inflammatory cells and the buildup of foam cells and of course, the cholesterol, right? The LDLs. So this is one major mechanism in which the wrong type of gut bacteria produces this metabolite, right? The TMA, right? The trimethylamine goes into the liver, where it is converted into trimethylamine N oxide, TMAO, and then essentially what happens is in the liver, that inhibits the healthy metabolism of cholesterol. So other problems that TMAO causes is decrease of bile acid pole size and inhibit bile acid synthesis, which also impacts cholesterol metabolism via alternating the intestinal cholesterol transport. So remember, our cholesterol is being dumped back into the gut and into the bowels, and it is also supposed to be released in our bowel movement. There are specifically reverse cholesterol transports that are also impacted, as we mentioned, by the elevated levels of TMAO. And it's also associated with enhanced macrophage cholesterol accumulation, which is, as we mentioned, as part of the migration into the layers of the blood vessels during the development of arteriosclerosis. So losing healthy or beneficial bacteria could lead to increase of inflammation. It could also lead to the overgrowth of those harmful bacteria that could increase TMAO. But there are also specific foods that could increase the levels of these metabolites. So let's get back to the picture for a second. And on the top here, on a red bubble, on the top left, you can see dietary phosphatidylcholine or choline. And those dietary factors could be red meat, could be beef, pork, lamb, veal, or processed meat and ham, egg yolk, and other full-fat dietary products like whole milk, yogurt, and butter that could increase TMAO, while fish, seafood, vegetables, and whole grain foods reduces it. And we've looked at 3 different published articles that tells us specifically which of those foods, right? The major one would be red meat, right? So essentially, we're not saying that patients should not eat eggs or should not eat butter or should not eat red meat. What we are saying is that, one, diet should be diverse. So diet should be diverse, and we're going to talk a little bit more about it towards the end of this discussion when we give you a little bit more specific recommendations. So it should be diverse. Patients should diverse their diet and replace red meat with fish and seafood occasionally. Make sure that there are vegetables and whole grain foods. That is important. But in their functional medicine approach, this is why we teach, by the way, nutritional medicine is part of functional medicine, because if you only learn functional medicine and you do not understand those nutritional pathways, you're missing a big part of it. But in the functional medicine approach, the pathway is pretty simple. Patient eat red meat or have high amounts of these imbalanced bacteria. They also have high amounts, elevated levels of TMAO, which inhibits their healthy cholesterol metabolism. So this is where, of course, we want to learn more about it, learn about the treatment strategies, learn more about this specialty lab testing to take a look at a snapshot of what's happening there in the patient's gut to better understand what do we need to do to address the root cause, right? So now you already know the 2 or 3 pathways through the gut and through nutrition that can trigger that can inhibit proper cholesterol metabolism. And addressing that will help tremendously to your patients in terms of long-term health and wellness, right? And we said that there's going to be 2 factors. So Dr. Chill, take us into what is the second factor that we want to mention in terms of the functional approach?
Yeah, absolutely. So when we are assessing our patients that have high cholesterol levels, right? So not only do we want to test their cholesterol levels, but there are other things that we want to assess for them. And Dr. Cohen mentioned the gut dysbiosis and gut health. The other factor is going to be their stress and their cortisol imbalances, right? So a study was conducted in 2013. It looked at over 91,000 people, and it found that there was a positive correlation between those who experienced chronic stress and then unhealthy cholesterol levels. So if you're chronically stressed, you are more likely to have imbalanced lipid levels, and then stress has been positively linked with having less healthy dietary habits and higher body weight. And these are all known risk factors for high cholesterol levels. If you want to read more about this, it's called The Relationship Between Job Stress and Dyslipidemia. And this was done on the Scandinavian Journal of Public Health. And this was in 2013. So how does stress react to our cortisol, and why does that cause a cortisol imbalance? So cortisol is the body's stress response. It's the stress hormone, right? This may be to blame because that it's been shown to increase abdominal obesity, increases the appetite, and it perpetuates a pro-inflammatory response along with increasing or triggering a cascade of a pro-inflammatory immune response in our body. So people who have long-term stress, they have consistently high levels of cholesterol due to these cortisol responses that are occurring with them. And high cortisol levels can increase obesity around the stomach, which can cause more fat deposits. And then it can affect fat in other parts of our body as well. And then it can also increase our appetite, thus increasing our cholesterol levels. Remember, when glucose increases in the bloodstream and the liver has reached its maximum capacity for storing glycogen, this can increase the glucose, which is converted into triglycerides. And that's how cortisol can influence our glucose in our bloodstream. We are going to dive deeper into cortisol next week. So make sure you tune in for that in-depth discussion of cortisol, how to test it, what to look for, and how to treat it. So we are going to dive deep into that next week. There are also other factors that are going to cause high cholesterol as well, and we will cover them in the Advanced and Clinical Functional Medicine program. But now you understand that we need to assess other factors that are involved with high cholesterol in our patients, from our gut health to their stress response. That's why it's important to ask in their intake, what their stress levels are, and then looking at their cortisol assessment for them when you have patients that have high cholesterol or hyperlipidemia.
Yes, thank you for mentioning that, Dr. Chill. It feels like a really good, now we have a really good understanding of the two major factors that contribute to that. The first one is changes in the gut, and then the second one is looking at the HPA axis and the secretion of cortisol, which we're going to talk in our next discussion next week. We're going to dive a little bit deeper into. But as Dr. Chill mentioned, remember, these are just two factors, triggers or factors, we can call them, that contribute to high cholesterol. There are several factors that contribute to cardiovascular conditions. For that reason, we have a whole module and a class just on cardiovascular conditions. And then we have a whole class just on the gut cardiovascular axis and what are the different connections and how changes in the gut change the function of the heart and how they lead to cardiovascular disease. That's a fascinating topic to anybody who sees patients with cardiovascular conditions. So check out those specialty modules in the Advanced and Clinical Functional Medicine program. And this is where we're going to get into some additional practical tools. We love to talk about the mechanisms and pathways and what you need to do and what we need to do to find the root causes. But we always love to talk about the clinical application. It's something that is so essentially important. So of course, in the advanced functional medicine, we have specific treatment protocols for each one of those factors. But we also want to give you now some of the nutraceuticals that could be beneficial. So the first one, of course, very important to mention, is the first compound is CoQ10. And the reason why we're saying CoQ10 is because so many of the patients that already come to see us and have cholesterol problems already get a prescription. Either you provide them a prescription or some other primary care practitioner provided them with a prescription of statin. And some of them could be coming in because they develop side effects and they don't like the drug, or some of them would coming in because they're thinking about getting off it, right? There's a lot of patients that don't take their medications as recommended because of those side effects, right? And so CoQ10 will be important because obviously the depletion of CoQ10 in the cells due to statins, and that leads to the muscle fatigue, and it leads to decline in memory, and it leads to all these different symptoms that we talked about. So what is the range of dosage? The range is typically between 100 to 600 milligrams per day for at least 1 to 3 months for patients who are taking statins, right? So initially you might, if they come and they have those particular side effects, you might put them on at 300 milligrams per day for 1 to 2 months, and then monitor them. You want to see them every 2 to 3 weeks, ask them about their symptoms. Typically within 2 to 3 weeks, 2 to 4 weeks, we want to see improvement in those symptoms. On, I would say, a wellness approach and a preventative measurement, probably 100 to 200 milligrams per day would be sufficient for most patients once those side effects reduce, once they're getting to a more a state of homeostasis, right, within that prescription. There is an interesting study that looked into 12 randomized controlled trials. It was a total of 575 patients, and about half of them, 294, were on the CoQ10 supplementation group, and the other 281 were the placebo group, right? Those are all patients that were taking statins. So they compared. One group was taking statins with CoQ10. The other group was taking statins with a placebo. And they found that compared to the placebo group, the group that was taking also CoQ10 had significantly less side effects, such as muscle pain, right? So this is an important study that shows us that taking CoQ10 together with statins can be beneficial for patients that are struggling with those side effects, right? And here's we posted the citation for the study, so you can read more about it. It's called The Effect of CoQ10 on Statin Induced Myopathy, right? So this is an interesting study to read. Okay, so now we want to talk about 2 specific compounds that can help your patients to reduce their cholesterol levels. And this could be used with or without the statin medication. Their mechanisms are a little bit different. Both of their mechanisms are a little bit different. So Dr. Chill, take us into compound number 2.
Yes, so compound number 2, it's a mixed bag. So the first one, I kind of want to discuss a prescribing medication, right? So the first compound is icosapent ethyl. It's actually a form of omega-3, which is a pharmaceutical form of omega-3. It's a modified version of EPA, which is the kind of omega-3 fatty acids that's extracted from fish oil. And as I was saying, this is actually a prescription medication with the generic name being Vascepa. And so it is not necessarily, it's not a controlled substance, but it's been shown to lower the amount of triglycerides that your liver makes and releases. And then according to the manufacturer, Vascepa is the first and only FDA-approved medication to lower CV risk, in addition to other medications such as statins. So in patients with high triglycerides above 150 and heart disease or diabetes with other cardiovascular risk factors, this may be a prescription that you can use for our prescribing doctors and practitioners that are out there. And the dosage is 2 grams twice daily, and this was shown to reduce cardiovascular events and cardiovascular related death by about 25% to 20% respectively. And you could read a little bit more about this on the article called Cardiovascular Risk Reduction with icosapent ethyl for hypertriglyceridemia. And this was in the New England Journal of Medicine, published in 2019. Now, if you don't prescribe, then what we could do is recommend considering omega-3s. There was a really interesting study, or actually a meta-analysis that was completed and published in 2020 that compared the impact of statins versus omega-3 supplementation for cardiovascular death. And after they reviewed 55 studies, the authors concluded that both therapies were effective for reducing risk of death due to cardiovascular disease. While the statins were more effective, there were borderline differences between the effect of statin use versus omega-3 supplementation in CVD death in the total population. So the drug Vascepa, which I just mentioned, produced a dose-dependent increases in omega-3 concentrations in the plasma and the red blood cells, which helped to reduce the cholesterol levels. However, EPA supplementation, which is just omega-3s that you can get through places like Fullscript or Emerson, we recommend doing the pharmaceutical grade or the professional grade supplements with these that have been tested. And what you want to consider is doing a dosage at 1 gram to 4 grams, because this has been shown to have similar effects on the red blood cells as the Vascepa or even the statins. And this study, if you want to read about it, is called All-Cause Mortality and Cardiovascular Death Between Statins and Omega-3 Supplementation. And this was a meta-analysis and network meta-analysis from 55 randomized controlled trials, and this was in the Journal of Nutrients in 2020.
Wonderful. And this is where, a lot of patients have heard and practitioners have heard of omega-3s. They just don't know. And I guess this is something you learn more when you go into advanced clinical nutrition, is that with omega-3, there are different types of fatty acid. and we got the DHA, and then we get to EPA. And EPA is really what we want to use for cardiovascular condition. It's not just the whole range, full spectrum of omega-3s, although that could be beneficial. For heart cardiovascular condition, we want to use the EPA. That's what we would recommend. Like Dr. Chill mentioned, there's a lot of really good studies on it, and also how it reduces inflammation and all of that. So 2 really good recommendations. And then we have the third, this would be the third factor, this third compound that we're going to go into. And this would be the red yeast rice. So red yeast rice, try to say that 5 times in a row, red yeast rice, is made by essentially fermenting rice, and contains a natural statin-like compound that is called monocholine K. And monocholine K at up to 10 milligrams per day inhibits an enzyme that is involved in cholesterol synthesis, which was found to lower the LDL cholesterol by about 15 to 25% within 6 to 8 weeks. That by itself is a pretty remarkable effect for just a natural compound. And this is why when we teach about nutritional medicine in the functional medicine, the advanced functional medicine approach, we really show how when you understand the mechanism, the pharmacodynamic, and the research behind some of those compounds, you start to understand how powerful this stuff is, right? Now, what is the dosage that we're going to look into? The dosage will be between 1,200 milligram to 4,800 milligrams per day in split dosage. So maybe 1,200 milligrams in the morning, 1,200 milligrams in the evening. What's more important than the general dosage is to make sure that the active ingredient is there. Jacob, can you show that previous one? Which is monocholine at 10 milligrams per day. The studies show up to 10 milligrams a day. If a supplement does not show the amount of active ingredient, then we recommend looking into a different supplement, because when it comes to pharmacodynamics and all these particular studies that we talk about, we want to be as specific as possible and adhere to what the researchers have used in their study. So that's pretty remarkable results. One thing to mention before we move into the lifestyle recommendations is that red yeast rice, but in particularly this monocholine K, is working in a very similar way to statins. So both red yeast rice and berberine, which also a very powerful supplement, they work. Some of these supplements work. The pharmacodynamic is very similar to statins. So if you are giving the patient those particular supplements, make sure that you're monitoring their cholesterol levels, because they might need an adjustment of their cholesterol medication. So, and I've seen patients before that did not need their cholesterol medication anymore when they started, slowly readjusted, and we addressed the root cause, of course. Omega-3 is a more general recommendation because it works through a few pathways that might not interact as much with the prescription of statins, but always monitor the patient to make sure that they're heading in the right direction. So now you know 3 compounds that could be beneficial when you see your next patient that is on cholesterol medication. Now, but that's not all, right? There is more that we can help those patients. So Dr. Chill, take us into some of the important considerations when we work with those patients.
Yeah, so these are simple lifestyle tips for your patients. We now know that there is a secondary cause of hyperlipidemia or high cholesterol levels, and this is due to lifestyle choices, right? So what we want to provide for our patients are some simple things that they can do that, to help mitigate those issues or prevent some of those issues from occurring for them if they're at risk for high cholesterol or if they currently have high cholesterol. Tip number 1 is to replace red meat with fish or seafood and legumes at least twice per week. Tip number 2 is increasing the daily servings of fruits and vegetables from 2 servings a day to 5 servings a day. So just telling them to have 5 servings of fruits and vegetables, this can this can lower their risk of death from heart disease by about 12% by just doing that. The other thing, or tip number 3, is to replace saturated fats with unsaturated fats, and these can be found in olives, avocados, fish, walnuts, and flax seeds. And this has been shown to reduce plaque formation, improve triglycerides, and HDL cholesterol levels. Or tip number 4, they can just eat 10 grams of soluble fiber, and this can lower their total cholesterol and LDL by 5 to 11 points. And the foods that have this fiber include whole grains, seeds, avocados, beans, fruits, and vegetables. You are noticing a theme here: a lot of fruits, a lot of vegetables, avocados, seeds, and beans. Those are the ones that you really want to incorporate into their diet. The step 5 is going to be limiting their trans fat and simple sugars, such as if they're adding in sugar to their food, right? This excess sugar can be converted into triglycerides in the liver, as we mentioned earlier. And then the American Heart Association also recommends omega-3s, which we previously mentioned, for lowering triglyceride levels at typical dosages between 1 to 3 grams per day. And then for exercise, trying to keep it as simple as possible, I just recommend 150 minutes of moderate intensity, right? They're breathing a little bit hard, or 75 minutes of intense, vigorous aerobic exercise where they're breathing harder per week. If they're doing that multiple times per week, this is going to have greater benefits for them. But the typical numbers are 150 minutes of moderate intensity or 75 minutes of harder intensity where they're breathing harder of aerobic activity per week.
Wonderful. And these are recommendations that, of course, you can have those recommendations just printed out and have a little flyer you hand over to a patient, or you can even just pick 1 or 2 strategies from that, right? And have a quick conversation with the patient about, would I like to learn about the root cause and what's contributing to their chronic conditions? And that would that opens the door to talk about functional medicine, right? Or if you ask them and if you tell them about the medication, but you also mentioned that there are a couple of strategies you can mention to make sure that they're not going to continue to get worse, right? And that would be a more natural approach to help their body to function better. And just pick 1 or 2, maybe replacing red meat with fish or seafood or legumes once or twice a week, right? That's already taking them on the right direction. Or just picking 2 vegetables with every meal beside potatoes. I already know what some of our patients are thinking. Oh, a vegetable, I'm going to do a baked potato or fries, right? So we don't want starchy vegetables, of course, that converted to glucose in our body fairly quickly. So we want, like Dr. Chill mentioned, just add 1 or 2 green leafy vegetables. That's got fiber, it's got phytonutrients, all that good stuff. Just 1 or 2 green vegetables to your plate, whatever it is that you're eating, right? That's going to already start taking them in the right direction. And of course, as we mentioned, in the Advanced in Clinical Functional Medicine program, we dive deeper into those mechanisms. We even give you very specific treatment strategies. There's also a clinical guide you can use that has the whole functional medicine 7-week or 3 months program you can offer to your patients. So we're giving you a lot of those tools already in the program. And Dr. Chill, for our students our community members that are in our advanced functional medicine program, Dr. Chill is operating the Quick Start, Functional Medicine Quick Start program, which he actually works one-on-one with you to show you how to use the functional medicine evaluation tool. And it helps to flush out the major 2 or 3 contributing factors. So you don't have to spend time with patients asking them all the questions about the root cause. That particular evaluation tool already does all of that for you. So that's a very, very powerful tool. And Dr. Chill, when you meet with him one-on-one, he will show you how to use it. And Dr. Chill, I think a lot of our community members have used it on themselves, right? First, as patients to kind of get an idea of how it works.
Yep, they're either doing it on themselves or their community members or their family members that are wanting to use a functional medicine approach just to kind of get started in functional medicine. Or if they already have patients, right, they'll have their patients fill that out, and I'll go through how to prioritize all of the different contributing factors in that functional health survey so they can figure out how to look at labs, what lab tests to do, how to prioritize those labs, and even how to prioritize treatments for them.
Yes, absolutely. And that's what I love about the Quick Start program that you're running, because they're getting the evaluation tool right there. The patient can fill it up before they show up. And then they also get the clinical guide that matches the evaluation tool. So they got the evaluation and the treatment and the recommendations all right there. And they can use it on themselves to improve their health, or a patient or a family member. I used it on myself. It was tremendously helpful to understand the things that I knew and the things that I didn't know about my body, what's functioning and what not functioning well, and what needs to be optimized. And then, of course, I used it on first my father. I used it on other friends, and then a lot of patients. So it took us probably about 5 or 6 years to develop this clinical tool. A lot of probably hundreds of hours of developing this together with other functional medicine experts. So when you're in the program, the Advanced and Clinical Functional Medicine program, use it. Schedule a call with Dr. Chill. Watch the 12 to 20 minutes mini classes in the Quick Start program, and then schedule your session with Dr. Chill so he can do that work with you. And we had some incredible feedback. I mean, Dr. Chill, you've communicated with those providers, but I get the email saying, "Oh, thank you. This was so helpful. I can already start using this from my second or third week in the program," right?
And I think that's the biggest thing. It's because functional medicine is so complex, right? We're dealing with chronic issues, which means there's a lot of different contributing factors, as you're knowing by coming to these podcasts. There's all of these different contributing factors. So how do we prioritize all of those different factors, all of those underlying causes, and do it in a way that is easy for your patients to digest? And that's what that functional health survey is all about. It's a really good guiding tool to prioritize where to focus on and where to assess for our patients and where to start with for our patients.
Yes, exactly. One of the things that I remember filling that form for myself, it was a great learning experience on really, because it flushes out when you look at it, the specific signs and symptoms of each one of those triggers and factors. And it was really helpful. It was a great learning experience for me to kind of go over it and see, oh, okay, these are the symptoms that I now can recognize when they have this trigger or this factor. So it's a great learning experience. It's not just a part of it's not just learning functional medicine from a class, but it's also learning through experience in functional medicine. So that's why it's just an awesome program. So with that being said, we talked about a lot today. We talked about the functional medicine approach, the root causes to high cholesterol, what are some of the issues with the statin prescription and how to mitigate that, what's the right appropriate supplement to use when they have those side effects, and then some natural alternatives to the medication. So now this is why we love being here with you, because it's our passion to equip you with the knowledge, insights, and tools to change your patients' lives. And I had the honor of talking with one of our graduates. We had a recording. We submitted it. We shared it with everybody a few days ago in the email. And she's doing so amazing. She's a nurse practitioner, has built a functional medicine practice, and she's charging $800 per session, per appointment, and she's got a 3 months waiting list. So this is just to show you how remarkable this is and how much this is so much needed in today's healthcare, in health system, right? It's more of a sickness management system than it is a healthcare system, right? So this is why it's needed. It's needed in every city. It's needed in every country. It's needed in every state. We got students from 15. We had community members from 15 other countries. In the last few months, we had more and more from the Middle East, from Dubai. We just had a large practice in Dubai, that functional medicine, that wanted to sign in all their practitioners, and it was remarkable. So this is the right way to do medicine. Every practitioner should know this and either integrate it with primary care, or as some of our community members do, they just set up a completely separate functional medicine consultation. It's an awesome service to offer patients. You get amazing clinical outcome, and of course, it's another major source of revenue for yourself, for your practice. So if you have any questions, reach out to us. We'll be happy to share our recorded conversation with our graduate, Gina, who shared with us how she does it and all of that. As usual, we're here for you. We got some amazing stuff coming up. And I wanted to thank all of you for being here, advancing your skills, and investing in learning functional medicine for yourself and for your patients. And I want to thank Dr. Chill for
always a pleasure here.
for putting this together for us and sharing his experience. And I also wanted to thank our media team and Jacob, which without them, we couldn't be communicating with you wherever you are, right? So it's wonderful to be here, and thank you all for being here. And I hope you have a wonderful evening, and take care of yourself, and we'll see you in the next class.